everyone, it's Jessica Jarabek coming to you from Victoria, British Columbia, where we are honoring our Coast Salish nations and Indigenous peoples. I'm a registered massage therapist here, and I'm also an international teacher, and again honoring all those multicultural therapists that make our massage community so wonderful. This is going to be a program for the PIDP 3351, where we're going to be talking about clinical massage therapy assessment. And so let's just jump right into it here. If you've ever taught or studied massage therapy, you know that learning goes far beyond memorizing muscles, names, or mastering a set of techniques. The real growth happens in the clinic when students begin connecting touch, theory, and empathy to meet a client's real needs. That's where assessment becomes more than a guiding tool, it's a learning engine. Massage therapy education researchers talk about 3 complementary types of learning. This is going to be assessment of learning, which is measuring, checking what you know and can do. Assessment for learning, which is guiding improvement. And assessment as learning, which is using reflection to shape who you become, empowering self-reflection, and lifelong growth. So I've created this blog post so that we can not only talk to our students about it, but also as teachers and educators, and we're going to be learning how together they all create a powerful cycle that transforms massage into a reflective, self-directed clinical profession. So assessment of learning, this is showing what you can do. So the purpose of this is to confirm students meet required standards of competence, to evaluate knowledge, skill, and attitudes at a specific point in time. So this would be, the timing for this would be at the end of a unit or clinical placement. Examples that we have for in-practice use would be final hands-on practical, where students perform a full treatment on simulated or real clientele, practical exams, assessing techniques, execution, different types of case study presentations showing how assessment data and client feedback are informed for their treatment plans. Also, supervisor evaluations is another example, would be based on professional competencies like safety, communication, ethics, and techniques. And so again, this isn't just for the students, this is also for teachers and even parents of the students. So I've added in these teaching tips and why it matters. So they're down here a little bit. So these are assessments of learning, ensures competency and safety, that you meet professional standards before working independently. It provides a snapshot of your current abilities. And again, for example, we have those final clinical assessments, draping, instructor evaluations, posture biomechanics, even client interactions and flow. You're all measuring these against the program criteria. So just to remember that you want to be using clear rubrics with language that students understand. So this does help reduce anxiety and gives transparency to what you're teaching. And so these demonstrate the assessments of learning. So number 2 here, assessments for learning. It's growing through feedback. So the purposes here is to help learners improve as they practice, to use assessment as learning opportunities, and the feedback helps you improve while you're still developing. Again, the timing for this would be continually and during clinical placements. During practice, you could use this after each client session, where the supervisor gives positive feedbacks or different areas to focus on. These could be peer observations where students watch each other or work and share constructive feedback on body mechanics or client interactions. Again, learning journals is another one for assessment for learning, where after each client and clinic day, students reflect briefly what they did well, how will they change it for next time. Again, another teaching tip for this assessment for learning encourages you to adjust techniques and approaches based on observation and feedback. It builds critical thinking and bridges a gap between classroom learning and hands-on practice. Another example of this here, as you can see, would be after a clinical supervisor observes a session, they note that your pressure consistently improves, but communication about your client comfort could be clearer. So you set a goal to check in more frequently during your next session. So you really want to encourage dialogue, not monologue. Feedback should be a conversation where you might ask a student to paraphrase or set a goal in response. Again, for example, next session I'll focus on maintaining consistent pressure across the entire muscle belly. And then we have assessment as learning. So this is becoming a reflective practitioner. The purpose here is to nurture lifelong learning and professional identity, where we want to cultivate a self-awareness and self-regulation, where you become the primary assessor of your own work. Again, the timing for this assessment as learning would be throughout clinical education and beyond. So in practice, a self-evaluation checklist, students rate their performances before receiving supervisor input, reflective blogs or e-portfolios. They record significant learning moments. Today I realize how my own tensions affected my touch would be an example of that. Also, goal setting meetings where students and instructors co-design the next steps forward for growth. So here we have some teaching tips and why that matters. Assessment as learning builds independence, confidence, and abilities. You learn to recognize what's working, make evidence-informed adjustments, just as a professional therapist do in real practice. Again, for example here, after a client session, you record your reflections. I notice my thumbs quickly hurt during deep tissue work, so next time I'll adjust my stance and use forearm compressions to maintain pressure, would be an example that you might want to share with your students. So it's really important to integrate all three of these, and we really want to pull it together because when used together, these forms of assessment create a continuous growth cycle, not just providing competence, but cultivating curiosity, compassion, and confidence. So here you can see on this grid that I have is all the different types of assessment of learning, the focus, timing as we've gone over, and the main benefits of each of those. And so this is why it's very important to weave in all these into assessments while you're working with students. So in conclusion here, when students actively engage in all three forms of assessment, they take ownership of their own learning process, they develop clinical reasoning and decision-making skills, they learn to evaluate client outcomes and adjust accordingly, they transition from student mindset to a professional mindset. And so in essence, assessment stops becoming something that's done to you and becomes something you do for yourself, which is a lifelong professional habit. And again, all of these build on each stage upon the last, leading to the mastery, mindfulness, and autonomy. This is how we build better massage therapists, not just through practice, but through purposeful reflection and continuous self-assessment. So again, these aren't just for the students, but it's helpful for teachers and even parents of students to understand why we're using them. So of this blog here post, we do have the reference for the Canva design and then all the other APA references down here. And so I certainly hope that some of this helps everyone understand why it's so important to be using the assessment types of learning, for learning, as learning, with all these different examples. So this blog post is something that will be posted on my page, and something that we're looking to really have importance worldwide for the profession and the community. Thank you so much.